We are joined now by Wanda Barfield of the CDC. Wanda, welcome.
Oh, thank you.
Talk to me a little bit about what you love about coming to this conference. What do you look forward to the most?
Oh, you know what I love about coming to AMCHP is the opportunity to really re-engage with leaders in maternal and child health. There are leaders from states, leaders in communities, and it's just a great opportunity to spend time with them and learn about the challenges as well as the opportunities in improving health to women and infants.
Now you focus on reproductive health.
That's correct.
So what are some of the challenges facing the nation that really maybe keep you up at night? What has you constantly that mind churning?
So I think some of the major issues in reproductive health that are keeping me up at night is the challenge of teen pregnancy. Although teen pregnancy rates have declined considerably over the last several years, the U.S. still has teen pregnancy rates that are much greater than other developed countries, and we're seeing huge disparities in rates of teen pregnancy for African American and Latino women.
Why do you think that's the case?
I think some of the issues, well, there's a variety of issues, but I think some of the issues are education, helping teens to understand issues around the ways to prevent teen pregnancy. That includes education and appropriate, comprehensive, evidence-based, as well as the opportunity for those teens that are sexually active to have access to a full array of contraception.
Okay. Now looking ahead the next couple years or so, what are the biggest opportunities to accelerate progress for women and for reproductive health?
So I think some of the opportunities are really the opportunity for us all to collaborate and to work together to improve the health of women, infants, families, communities.
How much of that comes from the CDC and how much do you have to really depend on the states and the local jurisdictions?
Well, CDC works very closely with states. It's really our opportunity. CDC has the opportunity to build the evidence for effective practice that can be used at the state and community level. So that's a really exciting opportunity, and it's also important for CDC to hear from states, particularly Title V programs, about what some of the challenges are. Where are the issues in terms of evidence and science that they need to inform their practices?
What are some of the most common things that you hear under those categories?
So, infant mortality, very important issue. As you know, in the United States, still, although we're seeing rates that are declining, it's still fairly high. And we really have an opportunity also to try to reduce disparities for African American infants. So what we're hearing from states is how do we work together? And the participation of AMCHP, supported by HRSA, and the work around the COIN is a wonderful opportunity to do that. CDC is providing a lot of the data to help inform the COIN.
And so how do you take what you experience here and improve your work at home?
So one example is the work that we're hearing here around teen pregnancy prevention and how to not only improve the health of adolescents but also young adults, and how to improve the transition from adolescence to young adulthood to make sure that these young adults are getting appropriate health services.
Well, very good. You're one of the speakers.
Yes.
Is that an exciting thing
for
you?
Yes, very excited about participating in the opening plenary for AMCHP.
Very good. Wanda, it was a pleasure speaking with you today.
Thank you.
Thanks for joining us.
Thanks.